Hey guys, hope you're doing good. In today's video, we're gonna make a study guide, step by step for beginners about the ninth edition of the medical surgical nursing assessment and the management of clinical problems by Lewis Dirksen Butcher. So as you can see, this is the first page mentioned for the preparation by Susan A. Sandstone, and she is an associate professor in nursing, retired in College of St. Mary, Omaha, Nebraska. Also Sharon L. Lewis, PhD, FAN, Shannon Roth Dirksen, also Margaret MC Green, Linda Butcher, etc. Also reviewed by Charles D. Rogers, Advanced Cardiac Life Support Provider. He is also Assistant Professor of Nursing, Morehead State University, Morehead, Kentucky, as you can see here, and also viewed by Colin Broman Waddle. He is also Assistant Professor in Samuel Merritt University in San Francisco, Peninsula Campus, and San Mateo, California, as you can see here. So we move to the content here, as you can see. So for the section number 1, as you can see, concepts in nursing practice. We have for the first one, the professional nursing practice. And the second one, health disparities and culturally competent care. Third one is health history and physical examination. Fourth one is patient and caregiver teaching, chronic illness and older adults, complementary and alternative therapies, stress and stress management, sleep and sleep disorders, pain, palliative care, and at end of life, substance abuse. So this is it for section 1, which is the concepts in nursing practice. Moving to the second section, which is the pathophysiologic mechanisms of disease. We have the inflammation and wound healing, the genetics and genomics, altered immune responses and transplantation. Also, we have the infection and human immunodeficiency, virus infection. We have the cancer of fluid, electrolyte, and acid-base imbalances, as you can see here. So this is it for the section 2. We have also in section 3, which is preoperative care. We have the nursing management preoperative care, nursing management intraoperative care, the nursing management post-operative care, etc. So we have also in section 4, we have the problems related to altered sensory input. So we have the nursing assessment. We have also visual and auditory systems. The nursing and management, we have the visual and auditory problems. Nursing assessment, integumentary system. Nursing management, integumentary problems. Nursing management, we have the booms, as you can see here. Moving to other section, which is section 5, the problems of oxygenation, ventilation. We have nursing assessment, respiratory system, nursing management, upper respiratory problems. We have nursing management, low respiratory problems. We have nursing management, obstructive pulmonary disease, as you can see. So moving to other section, which is section 6, problems of oxygenation transport. We have nursing assessment, hematologic system, nursing management, hematologic problems, as you can see in the section 6. Moving to other section, which is the section 7, problems of oxygenation perfusion. We have nursing assessment, cardiovascular system, nursing management, hypertension, nursing management, coronary artery disease and acute coronary syndrome. We have also nursing management, heart failure, nursing management also this FMEs, nursing management, inflammatory and structural heart disorders. We have also nursing management vascular disorders, as you can see. Moving to other section, which is section 8, we have the problems of ingestion, digestion, absorption, and elimination. We have the gastrointestinal system, nutritional problems. We have the obesity. We have the upper gastrointestinal problems. We have the lower gastrointestinal problems. We have liver, pancreas, and biliary tract problems. We have also urinary system, renal and the urologic problems. We have acute kidney injury and chronic kidney disease, as you can see. This is for section 9, which is problems of urinary function. We have section 10, which is problems related to regulatory and reproductive mechanisms. We have the endocrine system, diabetes mellitus, endocrine problems, reproductive system, of breast disorders, sexually transmitted infections, the female reproductive problems, the male reproductive problems. Moving also to other section, which is the section 11, problems related to movement and coordination. We have the nervous system, we have the acute intracranial problems, we have stroke, we have chronic neurologic problems, Alzheimer's disease, the dementia and the delirium, peripheral nerve and the spinal cord problems. We have the musculoskeletal system, musculoskeletal problems, arthritis and connective tissue disease, as you can see. The last section, which is the section number 12, which is the nursing care in critical care settings, critical care, shock systemic inflammatory responsive syndrome, and multiple organ dysfunction syndrome, respiratory failure and acute respiratory distress syndrome, the emergency, terrorism, and disaster nursing, as you can see here. For the answers are in the worksheet 370, as you can see. So we begin with the chapter 1, which is professional nursing practice. So you must fill in the blank here and choose which one is the appropriate answer for the related question, as you can see here. So we begin with the first question, which is using the American Nurses Association's definitions of nursing, which activities are within the domain of nursing. So you have to select all that apply. A. Implementing intake and output of for patient who is vomiting. B. Establishing and implementing a stress management program for family caregivers of patients with Alzheimer's disease. C. Explaining the risks associated with the planned surgical procedure when preoperative patient inquires about risks. D. Developing and performing a study to compare the health status of older patients who live alone with the status of older patients who live with family members. E. Identifying the effects of an investigational drug on patients' hemoglobin levels. Or F. Using a biofeedback machine to teach a patient with cancer how to manage chronic pain. G. Preventing pneumonia in an immobile patient by implementing frequent turning, coughing, and deep breathing. H. Determine and administrating fluid replacement therapy needed for a patient with serious burns, or or uh, or I testifying to legislative bodies regarding the effect of health policies on culturally, socially, and economically diverse populations. So this is it for the first question. Moving to the second question, which is a nurse who has worked on orthopedic unit for several years and is encouraged by the nurse manager to become certified in orthopedic nursing. What will certification in nursing require and or provide? You have to select all that apply. So we have a certain amount of clinical experience, B, successful completion of an examination, C, membership in specialty nursing organizations, D, professional recognition of expertise in a specialty area, or E, an advanced practice role that requires graduate education. Moving to the third question, which is what accurately describes the healthcare system in which future nurses will be employed. So we have four choices. A, with improvements in medicine, there will be fewer patients with chronic illnesses. This is A. For B, rapidly changing technology and expanding knowledge will simplify the healthcare environment. C. The quality and safety education for nurses. QSEN project measures the ability of nursing graduates to be prepared for the reality of practice. Or D. The Joint Commission establishes national patient safety goals and evidence-based solutions for nurses to promote meeting these goals by all caring for the patient. Moving on to other question, which is the fourth one. What are the six competencies from quality and safety education for nurses QSEN that are expected of new nursing graduates? So we have to fill all the six competencies. So moving to the next question, which is the fifth one. Place the steps of the evidence-based practice (EBP) process in order. 0 being the first step, 6 being the last step. So we have to order these ones. So we have make recommendations for practice or generate data, ask a clinical question, so, critically analyze the evidence, find and collect evidence, evaluate the outcomes in the clinical settings, create a spirit of inquiry, use evidence, clinical expertise, and patient preferences to determine care. Moving to other questions, which is the sixth one. The following is an example of an evidence-based practice (EBP) clinical question. In adult seizure patients, is restraint or medication more effective in protecting them from injury during a seizure? Which word or words in the question identifies the C part of the Picot formula? So we have A, restraint, B, or medication, C, during a seizure, D, adult seizure patients, or E, protecting them from injury, as you can see. Also moving to the next question, which is the seventh one. We have two nurses are establishing a smoking cessation program to assist patients with chronic lung disease to stop smoking. To offer the most effective program with the best outcome, the nurses should initially, so we have the first one, A, search for an article that describes nursing and interventions that are effective for smoking cessation. B, develop a clinical question that will allow them to compare different cessation methods during the program. C, keep comprehensive records that detail each patient program progress and the ultimate outcomes from participation in the program. Or D, use evidence-based clinical practice guide guidelines developed from reviews of randomized controlled trials of smoking cessation methods. So moving to the eighth question, which standardized nursing terminologies, especially related to the steps of nursing process. So you have to select all that apply. We have A, Omaha system, B, nursing minimum data set, NMDS, perioperative nursing data, PNDS, C, nursing outcomes classification, which is the NOC, E, nursing interventions classification, which is the NIC, or F, NADA International Nursing Diagnosis. So you have to select all that apply. Moving to other question, which is the ninth one. The nurse working in a healthcare facility where uniform electronic health records are used explains to the patient that the primary purpose of such a record is to reduce the cost of healthcare by eliminating paper records, or B, prevent medical errors associated with the traditional paper records and handwritten orders and prescriptions. C, force the use of standardized medical vocabularies and nursing terminologies so that outcomes of patient care can be measured, or D, provide a single record in which all aspects of patient's medical information are readily available to any healthcare provider involved in the patient's care. And the 10th question, which is which actions are done primarily by an informatics nurse. So you have to also select all that applies. We have the first proposition, which is A, designs and builds computer systems. B, studies the validity of nursing information. C, trains healthcare providers to provide nursing care. D, communicates and accesses information from nursing staff. Or E, builds systems that support the processing of nursing information. Staying in this chapter 1, which is the professional nurse practice, moving to the 11th question, which is match the phases of the nursing process with the descriptions. Phases may be used more than once. So we have the phases and the descriptions. For the descriptions, we have analysis of data, priority setting, nursing interventions, data collection, identifying patient strength, measuring patient achievement of goals, setting goals, identifying health problems, modifying the plan of care, documenting care provided. And for the phases here, we have assessment, diagnosis, planning, implementation, and evaluation. So we have to match each one by the other one. Moving to other question, which is the 12th one. So during the diagnosis phase of nursing process, both nursing diagnosis and collaborative problems are identified. So which are collaborative problem statements? So we have to select all that apply. Of A, fatigue related to sleep deprivation, infection related to immune suppression, excessive fluid volume related to high sodium intake, constipation related to irregular defecation habits, hypoxia related to chronic obstructive pulmonary disease, risk for cardiac arrhythmias related to potassium deficiency, as you can see here. So moving to the 13th question, which is for the nursing diagnosis and written patient outcomes listed below, use the nursing interventions classification and IC to identify a specific nursing intervention to help the patient reach the outcome. So we have between A and B. So A is nursing diagnosis risk for impaired skin integrity related to immobility. Patient outcome, patient will demonstrate skin integrity free of pressure ulcers, as you can see. And for the second choice, which is B, nursing diagnosis, constipation related to inadequate fluid and fiber intake. So patient outcome, patient will have daily soft bowel movements in 1 week. Moving to the 14th question, a patient with seizure disorder is admitted to the hospital after a sustained seizure. When she tells the nurse that she has not taken her medication regularly, the nurse makes a nursing diagnosis of ineffective self-help management related to lack of knowledge regarding medication regimen and identifies the nursing outcomes classification, which is the NOC. NOC outcome of compliance behavior with the indicator performs treatments regimen as prescribed at a target rate of 3, sometimes demonstrated. When the nurse tries to teach the patient about the medication regimen, the patient tells the nurse that she knows about the medication, but she doesn't always have the money to refill the prescription. Where was the mistake made in the nursing process with this patient? So we have 5 choices: A, the planning; C, diagnosis; or B, the diagnosis; C, the evaluation; D, assessment; or E, the implementation. So we have to choose one between those 5. Moving to other question, which is the 15th. So we have to identify the 5 rights of delegating nursing care. So you have to select all that apply. You have the right time, the right task, the right patient, the right person, the right dosage, the right circumstance, the right supervision and evaluation, or the right direction and communication. So you have to choose on 5 between those. Moving to other question, which is the 16th. So you have delegation in a process used by the RN to provide safe and effective care is an efficient manner, which nursing interventions should not be delegated to licensed assistive personal UAP, but should be performed by the RN. Select all that apply. So we have administrating patient medications or evaluating stable patients, performing patient assessment, evaluating the effectiveness of patient care, feeding patients at mealtime, performing sterile procedures, providing patient teaching, obtaining vital signs on a stable patient, assisting with patient bathing. So you have to choose between those which is the right one, which is the right ones. So you have to select all that apply. Moving to other question, which is the 17th. So you have to match the following care planning tools to the description statements. There may be more than one statement per tool, and some statements may be used more than once. So you have the tools here and the statements here. For the tools, we have 3 options: the nursing care plane, the concept maps, and the clinical pathway. And for the statements, we have a plane that directs an entire health care team, used as guides for routine nursing care, used in nursing education to teach the nursing process and care planning. Description of patient can require specific times during treatments should be personalized and specific to each patient. A visual diagram representing relationships between patient problems, interventions, and data. We have also used for high volume and highly predictable case types. Moving to other questions, which is the 18th questions, which nursing actions are in responses to the national patient safety goals. You have to also select all that apply. So we have use restraints to prevent patient falls, administer all medication ordered by physicians, wash hands before and after every patient contact, conduct a timeout when too tired to provide care, use SBAR for communicating with health professionals, evaluate the initial existence of pressure ulcers before patient demission. We are moving to the 19th question, which is which quality of care measures influence the payment for healthcare services by third-party payers. So also you have to select on that apply. So we have for A, clinical outcomes, B, regulatory agencies, C, use of evidence-based practice, D, adoption of information technology, or E, occurrence of preventable conditions. So we finished with the chapter 1, which is the professional nursing practice. So we move to other chapter, which is the health disparities and culturally competent care. So we begin with the first question. We have the first question. Question: 62-year-old African American man has been diagnosed with lung cancer. Has been scheduled for surgery. The nurse recognized what as the most likely major determinant of this patient's health. So we have four choices. We have either A, he's African American, B, he chose to smoke all of his adult life, C, his father died of lung cancer at about the same age, or D, he has a limited ability to understand and act on health information. So if you we have to choose between these four choices or propositions. Moving to the second question, which is a 73-year-old white woman is brought to the emergency department by a neighbor who found a woman experiencing severe abdominal and lower back pain for 2 days, and noise and vomited for the last 24 hours. She has always refused medical care of any kind of and lives by herself up the mountain of dirt road in rural West Virginia. She had 2 children with the help of midwife, but they both left for the West Coast years ago, and she probably sees them. She was not married to the father of her children, and she has not seen him in years. She has barely made a living by sewing for a doll company and receives a small amount of public assistance. As ill as she is insistent that she will return home after she sees the doctor. So we have to list at least 4 factors in the situation that can contribute to health disparities. So we have four factors we have to list. Moving to other question, which is the third one, limited health literacy may be associated with which conditions that lead to disparities. So we have to select all that apply. We have the age, the place, the gender, the race or ethnicity, the language barrier, or the income and education. Moving to the fourth question, which is the cultural safety describes care that prevents culture imposition. The nurse must be aware of and include the knowledge of which factors in providing safe cultural care for the patient. So we have to select all that apply. We have values, culture, ethnicity, stereotyping, acculturation, ethnocentricity, as you can see here. So you have to select all that apply. The fifth question, which is what are four basic characteristics of culture? We have A, ever present, shared by all members, expected by all members, adapted to individuals. B, dynamic, shared values provides a baseline for judging other cultures learned from parents. C, ever present, not always shared by all members, but accepted by the group learned at school. Or D, dynamic, not always shared by all members, adapted to specific conditions, learned by communication and imitation. So moving also to the next question, which is the sixth one. Uh, Identify the specific component of acquiring cultural competence that is reflected in creating a safe environment in which collection of relevant culture data can be obtained during the health history and physical examination. So we have A, cultural skill, we have B, cultural culture, we have cultural awareness, or D, culture knowledge. Moving to the seventh question, which is identify an example of how each of the following culture factors may affect the nursing care of a patient of a different culture, and one example of the functioning of a healthcare team made up of individuals from different cultures. So we have the culture factor, which is time orientation, the economic factors, the nutrition, the personal space, the beliefs and practices. Then we have then second part, the effect on nursing care and the healthcare team. The eighth question, which is when admitting a woman experiencing spontaneous abortion at the ambulatory care center, the nurse notes that the admission form identifies the patient's religion as Islam. What should the nurse understand about the patient? She should not receive any pork-derived products. She probably will not have purchased health insurance. She probably will not, or artificial contraception and abortion are prohibited. Or she will not be able to receive blood or blood products if an emergency develops. Moving to the next question, which is in ninth one. So our spelletized Native American patient tells the nurse that later in the day, medicine man from his tribe is coming to perform a healing ceremony to return his world to balance. What should the nurse recognize about this situation? So we have also four propositions. So we have A, the patient does not adhere to an organized formal religion. B, the patient's spiritual needs may be met by traditional rituals. C, the patient may be putting his health in jeopardy by relying on the rituals. or D. Native American medicine cannot alter the progression of the patient's physical illness. Moving to other question, which is the 10th one. So in Hispanic patient who claims to have impartial watch assessment findings would the nurse expect? So A. Abdominal pain and cramping. B. Anxiety, insomnia, anorexia, and social isolation. C. Nightmares, weakness, and a sense of suffocation. Or D. Headaches, stomach problems, and loss of consciousness. Moving to 11th question. When the nurse takes a surgical consent form to an Asian woman for a signature after the surgeon has provided the information about the recommended surgery, the patient refuses to sign the consent form. What is the best responses by the nurse? So A, didn't you understand what the doctor told you about the surgery? Or B, are there others with whom you want to talk before making the decision? C, why won't you sign this form? Do you want to do what the doctor recommend? Or D, I'll have to call the surgeon and have your surgery cancelled until you can make a decision. So we have to choose one of those four. The 12th question, which is a male nurse would be providing culturally competent care by requesting that a female nurse provide the care for which patient, Arab male, Latino male, Arab female, or African American female. Moving to the next questions, number 13. We stay in the chapter 2, which is the health disparities and culturally competent care. So identify the drug classes that have a different response in African Americans when compared with the usual response of whites of European descent. So we have to select all that apply. So we have analgesics, antipsychotics, benzodiazepines, tricyclic antidepressants, or antihypertensive agents. Question number 14. Several cultural groups avoid direct eye contact, consider it disrespectful or aggressive. Which cultural group may not be returned a direct gaze? Arab, Asian, Hispanic, or Native American? So question number 15. To communicate with the patient who does not speak the dominant language, the nurse should. We have to select also all that apply. A. Specific slowly and enunciate clearly in a slightly louder voice. B. Use gestures and pantomime words while verbalizing specific words. Use family members rather than strangers as interpreters to increase the patient's feeling of comfort. Use dictionary of or phrase books that translate from both the nurse's language and the patient's language. Or E. Avoid the use of any words known in the patient's language because the grammar and pronunciation may be incorrect. So question number 16. Identify measures that the nurse should use to reduce healthcare disparities. So you have to select all that apply. Use cultural competency guidelines. Use a family member as the interpreter. Use a standardized evidence-based care guidelines. Complete the health history as rapidly as possible. Or include racial cultural differences in planning care. So we completed the second chapter. We are now in this in third chapter, which is health history and physical examination. So beginning with the first question, during the day while being admitted to the nursing unit 1, the emergency department, the patient tells the nurse that she is short of breath and has pain in her chest when she breathes. Her, respiratory rate is 28 and she is coughing up yellow spotting. Her skin is not her skin is hot and moist, and her temperature is 102.2 F Celsius or 39 Celsius. The laboratory results show white blood cell count elevation, and this bottom result is pending. The patient says that the coughing makes her head hurt and she aches all over. So identify the subjective and objective assessment findings for the patient. So we have to find the subjectives and the objectives. Moving to the second question, which is the for the patient described in question A, this one. So the female here with the temperature, the high temperature. The data will lead the night shift nurse to complete a focused nursing assessment of which body parts. So we have A, abdomen, B, arms and legs, C, head and neck, or D, anterior and posterior chest. Third question, which is number 3. So give an example of sensitive way to ask patient each of the following questions. Is the patient on anti-hypertensive medication having a side effect of impotence? B. Has the patient with a history of alcoholism had recent alcohol intake? C. What are the sexual contacts of patient with gonorrhea? Or D. Does the patient skip taking medications because they cost too much? So we have a priority decision for the question number 4 and number 5. Beginning with number 4, priority decision. Nurse prepares to interview a patient for a nursing history, but finds the patient in obvious pain. Which action by the nurse is the best at this time? So we have to select which one is the best. A. Delay the interview until the patient is free of pain. Administer pain medication before initiating the interview. C. Gather as much information as quickly as possible by using closed questions that require brief answers. D. Ask only those questions pertinent to the specific problem and complete the interview when the patient is more comfortable. Priority decision question number 5. While the nurse is obtaining a health history, the patient tells the nurse, I'm so tired, I can hardly function. What is the nurse's best action at this time? So we have 4 propositions also. Proposition A, stop the interview and leave the patient alone to be able to rest. B, arrange another time with the patient to complete the interview. C, question the patient further about the characteristics of the symptoms. Or D, reassure the patient that the symptoms will improve when treatment has had time to be effective. Moving also, we stay also in the chapter 3, which is health history and physical examination. Moving to other question, which is number 6. Rewrite each of the following questions asked by the nurse. So that is an open-ended question designed to gather information about the patient's functional health patterns. So we have either A. Are you having any pain? B. Do you have a good relationship with your spouse? C. How long have you been ill? Or D. Do you exercise regularly? Question number 7. A patient has come to the health clinic with diarrhea of 3 days duration. He says the stools occur five or six times per day and are very watery. Every time he eats or drinks something, he has an urgent diarrhea stool. He denies being out of the country, but did attend a large family reunion held at a campground in the mountains about a week ago. It identified the areas of symptom investigation using PQRST, but still need to be addressed to provide additional important information. So we have also to select all that apply. So we have A, timing, B, quality, C, severity, D, palliative, E, radiation, or F, precipitating. Moving to the eighth question, which is the following data obtained from a patient during a nursing history. So we have to organize this data according to Gordon's functional health patterns. So patterns may be used more than once, and some data may apply to more than one pattern. So we have also the patterns, as you can see here, and the data obtained. So we have 78-year-old woman, married, 3 grown children, all live out of town. We have cares of a invalid husband in home with the help of a daily home maker. We have also vision corrected with glasses, hearing normal, height high 5 feet, high 5 feet 10 inch, and the weight is 172. Vital signs: temperature 99.2 or 37.3 Celsius, HR 82B and P, RR 32 and BP are 142/88. We have also 5 years history of adult onset asthma, smokes 2 or 3 cigarettes a day. We have also coughing, wheezing with the state shortness of breath, moderate light yellow spotting. Says she has no energy to care for her husband. Awakens 3 or 4 times per night and has to use a bronchodilator inhaler. Uses a laxative twice a week for bowel function, no urinary problems. Feels her health is good for her age. Allergic to codeine and aspirin. Has esophageal reflux and eats bland foods. Can usually handle the stress of caring for her husband, but if she becomes overwhelmed, asthma wounds. Has been menopausal for 26 years. No sexual activity. Takes medications for asthma, hypertension, and hypothyroidism, and uses diazepam volume, PMR for anxiety. Goes out to lunch with friends weekly. Says she misses going to church with her husband, but watch religious services with him on TV. And for the patterns, we have demographic data, important health information, health perception, health management pattern, nutrition metabolic pattern, and also elimination pattern, activity exercise pattern, sleep rest pattern, conjunctive perceptual pattern, self-perception self-concept pattern. We have also role relationship pattern, sexuality reproductive pattern, and coping stress tolerance pattern, and the last one is value belief pattern. For the ninth question, which is what is an example of a pertinent negative finding during a physical examination? We have either chest pain that does not radiate to the arm, elevated blood pressure in a patient with hypertension. C. Pupils that are equal and react to light accommodation. Or D. Clear and full lung sounds in a patient with chronic bronchitis. Moving to the 10th question, which is match the following data with the assessment technique used to obtain the information. So we have the data here and the pattern here. We have normal blood flow through our arteries. This is it for A. For B, abnormal blood flow in the carotid artery. C, tympany of the abdomen. P10, edema. We have cyanosis of the lips. Hyperactive peristalsis. Bruising of lateral left thigh. Cool, clammy skin. And also we have for the patterns, we have inspection, we have palpation, we have percussion and auscultation. Moving to question number 11, which is what is the correct sequence of examination techniques that should be used when assessing the patient's abdomen? We have A, inspection, palpation, auscultation, percussion. We have B, auscultation, inspection, percussion, palpation. We have C, palpation, percussion, auscultation, inspection. We have D, inspection, auscultation, percussion, and palpation. Question number 12, which is when performing a physical examination, what approach is the most important for the nurse to use? So you have also for propositions: A, ahead to approach to avoid missing an important area. B, the same systematic efficient sequence for all examinations. C, a sequence that is least revealing and depressing for the patient. Or D, in an approach that always allows time to collect the nursing history data while performing the examination. Question number 13, which is the nurse is performing a physical examination on 90-year-old male patient who has been bedridden for the past year. Which adaptations for performing the examination would be appropriate for the patient? So you have also to select all that apply. We have 5 propositions here. Proposition we have A, make sure that a family member is with him. B, handle the scan with care because of potential fragility. C, keep the patient warm and comfortable during the assessment. D, allow the patient to watch TV to distract him from any painful assessments. Or E, place the patient in a position of comfort and avoid unnecessary changes in position. Moving to question number 14, in what patient situations would a comprehensive assessment be performed? So we have also to select all that apply. Compliance of chest pain on initial admission to the telemetry unit. On initial evaluation by the home health nurse, the patient is found lying on the floor and unresponsive. Or E, on arrival in the surgery holding area of the operating room. Moving to other question, which is which assessment tools can be used to assess the cardiac system. So you have also to select all that apply. A, the watch. B, the stethoscope. C, the ophthalmoscope. D, percussion hammer. Or E, the blood pressure cuff. Question number 16. What is the term used for assessment data that the patient tells you about? So A, focused. B, objective. C, subjective. Or D, comprehensive. So you have also to choose which one is the right one. Question number 17. On the first encounter with the patient, the nurse will complete a general survey with features are included. We have also to select all that apply. So we have A, mental state and behavior. B, blank sounds and vowel tones. Body temperature and pulses. D, speech and body movements. E, body features and obvious physical signs. Or F, abnormal heart murmur and limited mobility. So this is it for the third chapter, which is the health history and physical examination. So for the chapter number 4, which is the patient and caregiver teaching, we have also the same questions. We have also to select all that apply. So if we move to other chapters, this is it for the fourth one. The fifth one, which is the chronic illness and older adults, as you can see here. Also we have 21 questions. The sixth one, which is the complementary and alternative therapies, as you can see here. The seventh one, which is stress and stress management, with different types of questions here, as you can see. Also chapter number 8, which is sleep and sleep disorders. Chapter number 9, which is pain. Also with the case studies, also discussion questions, different types of questions comparing to the first chapters, number 1, 2, and 3. Chapter number 10, which is palliative care of at end of life, as you can see here. Chapter number 11, which is the substance abuse. Also with case studies and discussion questions. Chapter number 12, inflammation and wound healing. Also with case studies and discussion questions. Chapter number 13, genetics and genomics. Also with case study and discussion questions. Chapter number 14, altered immune responses and transplantation, as you can see here. Also with the case study and the discussion questions at the end. Chapter number 15, infection and human immune deficiency virus infection, as you can see here. Also with at the end the case study and the discussion questions, as you can see. Chapter number 16, the cancer, as you can see here, with the case study also and the discussion question at the end. The chapter number 17, which is fluid, electrolyte, and acid base hemolysis, as you can see here. Also with the case study and the discussion questions at the end. Chapter number 18, the nursing management, pre-operative care, as you can see here. chapter number 19, the nursing management and operative care, as you can see, with the case study also and discussion questions. Chapter number 20, with the nursing management post-operative care, as you can see here, with also the case study and the discussion question. Chapter number 29, with the nursing assessment visual and auditory system, as you can see here. So if we can move into the other chapters, as you can see, until chapter 31, 32, as you can see, 35, nursing management, 41 chapter, 43 for the nursing management lower gastrointestinal problems, 47, 49, as you can see, the 43, 53, sorry, the 60, until we complete the guide. So be with the list of case studies in the study guide, as you can see, and the answers of the all the questions we had. As you can see, the answers to worksheets. We have at the end of the guide. We have all the answers that we saw in the beginning of each chapter. I guess there is 60 chapter, as you can see here. So this is it, yeah, for today's video. As we saw the study guide for medical surgical nursing, step-by-step assessment and management of clinical problems by Lewis Dirksen, Boscher, as you can see here. The 9th edition, I guess there is 11 editions, so we have the 9th edition here. So yes, this is it for today's video. Thank you for your time and see you in the next video.